Hey, it's Dr. Adams. So I want to go over a frequently asked question. What's the difference between what we do here at Align Live Katie and what most of you have experienced? And number one is that I use the Gonstead system, which is the absolute best way of practicing chiropractic that I have found. The reason is because the Gonstead system has 5 objective measurements to give us and you certainty and quantitative information, which basically just means that if we can measure it, we can make that predictable and reproducible. For example, most chiropractors have 1 or 2 things that tells them, when and where to adjust something, but do they have the information that tells them when not to adjust? Because that can be the most important thing for that visit. The 5 tools that we have to master are 1, visualization, which is simply taking the time to really look at the person in different positions. And I always tell patients that the skin will tell on you. And static palpation is the number 2, which is we're just feeling for pockets of inflammation. If there's inflammation, there's a problem. Number 3 is motion. We want to see what moves and what doesn't from side to side. Number 4 is instrumentation. So I have 2, one that reads temperature and one that looks at electric currents. I have 2 just because I'm always trying to argue with myself to make sure that I have the most accurate information. Number 5 is a snapshot of the current biomechanics. So I'm taking an x-ray. I do a very in-depth analysis on each patient. Also tells me if we have any red flags on a patient's condition. I think of all of these different tools like checks and balancing system, and it really helps me find the root cause of what's going on in a person's body. Hopefully this message was clear. Please comment or DM if you want me to dive deeper into this topic, or if there's something else that you really just want to hear from me.